How strict is the year of graduation criteria? Someone's asking, my year of graduation is 2014. Programs say we prefer candidates who graduated in the last 5 years. Should I apply to that program? So as you know, there are various criteria. Some are very hard criteria, others may be soft criteria. So let me give you one example. Visa is a very strong criteria. So if a program says they don't, either accept J1 or they don't do H1B, then they don't, right? So that's a very hard criteria. Scores can tend to be a harder criteria also. So if they have a scores criteria, difficult to play with. Year of graduation is a softer criteria. So if the program is saying we prefer applicants in the last 5 years, you could check with them, but you could apply as well. Preference is different than saying we only accept someone in this year of graduation range. So if you cannot check with them, you should go ahead and apply. Year of graduation tends to be a softer criteria. So more on tele-rotations. Yes, tele-rotations are an in thing. A lot of IMGs, in fact, a lot of IMGs this year who are either stuck in their home countries or even in the US if they cannot travel, or they are multitasking, doing research, tele-rotations, they are doing it. Programs are fully aware of it. They will expect it. Is it same as hands-on? Probably not, but we had a big discussion last week on what they will look for in tele-rotation. So there are types of tele-rotation. In some tele-rotation, it's mostly didactics, case discussions. So use that to your advantage. Discuss those cases. Peer interaction is something that will come up that you can showcase as part of what you learned in this tele-rotations. Maybe that will lead to some research opportunities. But in other tele-rotations, even with our physicians, you actually get to interact with the patients. You discuss this with the physician. So if it's on the normal or the US times, you will be able to interact with the patients as well. So history, physical, and some of the other aspects that you pay attention to as on-site, you will be able to do here as well. Does step 3 play a big role in getting more interviews? Now step 3 is again some of the things can help, but let me tell you where step 3 comes in. If you're a recent graduate with high scores, probably step 3 is not going to increase your interview count. However, if you are an older graduate, you have gaps or you have attempts or lower score, step 3 will help. Step 3 also has some correlation with the specialties. So in general, of course, all specialties, it is okay to take step 3. More so internal medicine, they always like to see step 3 if you have lower scores or gaps or attempts. The psychiatry is big on step 3 for the same reason. But some of the other specialties may or may not pay that much attention. So pathology may not pay that much attention to step 3. So again, I think more on tele-rotation. What exactly is the tele-rotation? How can we get that? So what is tele-rotation? Tele-rotation is where you are actually think of it as a CS encounter on, when CS used to be there, CS encounter over video. So you are either on Zoom, Skype, or whatever online platform the hospital or the clinic is using. You are interacting with the physician, and there are others in the same kind of platform, on the same platform, your peers, other students doing that rotation. So physician is either discussing a specific case or something around didactics. So the teaching session, that is one way. The other is you are assigned a patient, so the patient also logs on to that platform and you take that history, physical, you come up with a plan and you discuss with that physician. So something similar, very similar to online rotation, just that the platform could be Zoom, could be Skype, could be something else. How can you get tele-rotations? Well, we have some on our website. You can look at that. I'm sure there are other platforms or other, some of the other players you can get tele-rotations, but if you go to our website, you should be able to see some available opportunities. What are the chances without USCE in the 2021 math season? Good question. I think if you are a recent graduate, USCE may not, and with high scores, you should definitely go ahead and apply, because COVID started in March, and this is a very legitimate, I won't say an excuse, but it is a reason why you couldn't get USCE. So recent graduates definitely with let's say in IM 220s, 230s, definitely take a shot at it without US. But although I will say that try to get tele-rotations if you have no USCE, right? So recent graduate, you can apply without it. But try tele-rotations. If you are an older graduate, then it's a hard pill to swallow. COVID happened just in March. Without USCE, it'll be tough. But again, tele-rotations may just save it for you. So try to do it. Try to improve your research profile. This season is uncertain, and try to take advantage of the uncertainty in your favor. What are good scores and low scores in your point of view? Well, I could give you a general answer, but it depends on the specialty. It depends on what other things you have in your profile. So for example, in the top 6 kind of categorical specialties that IMGs typically apply for, say IM, neuro, family medicine, path, pediatrics, so on and so forth. Obviously, high score in IM would be 260s, 250s, but people have matched in IM with multiple attempts with 210s. It depends, they may have had good research or something else in their profile. Likewise, the other specialties like neuro, family medicine, pathology, they may be more lenient on the scores, but they look for specialty specific profile. So I would say you can match anything, say a 210, it depends, and visa will play a role as well. If a person has 2 US LORs and 1 hometown LOR, does it help? Yes, of course it will help. Why not? 2 US LORs should be good enough for you to try this season. How can someone with multiple attempts in all steps, including step 3 and long year of graduation, cross the automatic score attempts filter that programs set? So in a lot of cases, it has to be a long-term outreach plan you should have with the for the season. So try talking with the program, sending them emails. Otherwise, yes, you're right. They may not include you in their shortlist. Of course, building a profile always helps. Research will help you. Probably rotations only will not help you. What does high score mean? Well, again, high score is as high as possible. What is the range of high score? Let me pick internal medicine. Internal medicine, high scores, 240s if you need visas. 240s, 250s, 260 is all high. The higher you are, the better it is. If you don't need visa, 230s is okay. 220s also is okay. But there are other factors you should understand. Recent graduation, 230s will be a very good score, for example. What is your opinion about year of graduation in the following example? 5 years YOG and program lists 2 to 3 years as a limit. Yes, unfortunately, if the programs are saying that we only take candidates with 3 years YOG, you probably will not be able to apply. You can call them and check. Like I mentioned, YOG is a soft filter. Can MD peds in India match into IM in US? Yes, possible, but remember that pediatrics would be obviously your core specialty. You've done your residency there. If you can show IM related skills and experiences and you're probably work in the US in IM, it is possible. Does more publication help to cover USCE this season? So these two are different things. USCE, is showcasing your clinical skills. Publications are showing your research acumen. Both are important. Is one a substitute for the other? Probably not. But yeah, if you cannot get USCE, publications will help. Again, publications vary in their quality, so there's not a right or wrong answer. I think both of these have a place in match. We'll just have to look at your profile. What is the YOG in India after profs or after internship? YOG typically is after the date or the year mentioned in your diploma when the diploma was issued. How many months is considered a gap? Well, up to 6 to 9 months, you shouldn't have a problem. Anything above that is a gap. 2018 graduates are late graduates or in between or something. 2018 is relatively recent. You should be fine. Having 3 USCE in IM, 1 home country internship in pathology. IM and home country internship in pathology, can it be used to apply in both specialties? I don't understand what internship in pathology means. Is it a 1-year internship in pathology? In general, pathology will look for pathology specific LORs and USCE. Is research and publication important for IM? Research is important for all specialties, including IM. It just depends what other parts of your profile are. Yes, research is important, but again, if you're a recent graduate, probably you're not expected to do as much research, but in general, yes, research is increasingly becoming important. How many publications is a number that can make a difference? Again, quality beats quantity. It is not about the number itself. It is about what your role was, what kind of research you did, where it was published, the impact factor. That makes a difference. Matching in general surgery, again, high scores, research, those would be some of the things that will help. Obviously, if you can get related rotations, hard to, give a specific answer without a specific question. Would a 240 score in both step 1 and CK give a good chance in 2021 match? Yes. With a YOG, as you're mentioning, 2019, no USCE, USLORs, but you are at 240 in both steps, go for it. How important is research for PED? Like I said, research is important in all specialties, but also depends on other parts of your profile. So just asking this question, how important is the research? Research is important. Try to do it if you can, but remember other parts. Applying to general surgery, again, I think it's a similar question to above. If you cannot do on-site rotations, do tele-rotations, work in your home country. The more related experience you have, the better. Surgery also looks for your ability to handle stress, high stress environment. So if you are in a busy hospital in your home country and in a surgical specialty, always helps. If you've done home country residency in general surgery or any procedural specialty, that will help. High scores will always help. Can we do IM tele-rotations in 2 different hospitals simultaneously? Yeah, so people are starting to do it. Will it be questioned? I don't think so. I think it shows your initiative. As long as the timings are different, obviously you should be fine. And in the eras, you're obviously writing the average hours. So as long as you can balance those hours, if you say 60 hours at both locations, then obviously they will not believe it, right? So 120 hours a week is not going to help in tele-rotations. But as long as you can show reasonable hours in both rotations, you should be fine.